All right, well, hello. My name is Mike Lonzi. I'm Director of Healthcare Alliances here at VMware, and I'm joined by Wes Wright, the CTO of Imprivata.
Hi.
Today, we're going to talk to you about the unique challenges we see within the healthcare space and how Imprivata and VMware are partnering together to solve those for our healthcare customers.
Great. Hey, thanks, Mike. Thanks for having me. You know, Imprivata, we think of the unique challenges within healthcare along 4 planes. The first, of course, is the users and the roles that those users may or may not have. And that used to be pretty easy. It was just the clinician. But now we see external users coming into there. We see administrative users coming into there. And they're coming in from different locations at different times. They come in from the traditional hospital, and please excuse my hospital drawing there. They come in from home, you know, and now with all the other devices that they have, mobile devices, they come in from the road more and more often. And they do that using a phone. This is the device plane. They use a tablet. They use thin and zero clients. When it used to be, the old fat PC sitting on the desktop was the only way that they access stuff. And then finally, it's the applications plane. This one, I think, has changed more than any other. It used to be, you know, from the data center, we would serve an app up to one of these devices, easy peasy. But now we have the cloud apps. We have the SaaS apps. And now we have the apps that go on these phones over here. But at Imprivata, what we think ties this all together, the users, locations, the apps, the devices, is digital ID. So digital ID is what helps us get our healthcare customers the service that they need, the access and the authorizations that they need. But it's through partnerships like we have with VMware that actually gets them the applications and things that they need. So want to tell us how they do that, Mike?
Absolutely. Thank you, Wes.
Sure.
And we're really aligned with when we talk about our problem state and what we're seeing in the healthcare field, what folks are struggling with. You know, in VMware, we look at it even very similar. We look at it from any device, any app, to anywhere. When we think about that, and a physician who's mobile, transferring between clinic to hospital to home, right, and all of the different pieces of technology that they have to interact with, you know, what does that do for them? It makes them unhappy, right?
It does.
Getting access, right? Getting access to all these applications on all my different devices in order to give effective patient care is very challenging.
Right. All our clinicians want to do is provide care, and they've got these challenges that they have to deal with.
So now talk to me about how digital ID is tying that together and allowing our providers to spend less time with technology
sure.
and more with the patient.
Okay, so like I said, at Imprivata, we think about everything from a patient perspective, not a patient perspective, but a customer perspective. And that is, we want to make technology as transparent as possible to our clinical partners. And we've traditionally done that through the old Imprivata Tap and Go, or the Imprivata One sign, as most folks know about. But now we can do it on mobile devices. Now we can do it on medical devices. And we think that our response to these unique healthcare challenges that our clinicians has is to, wherever there's a digital identity event that takes place, an authorization or an access that needs to happen, we need to make that as transparent as possible to our clinical users. But we really can't do anything about how we get the apps to the home, to the device, and that kind of thing. And that's where the partnership with VM comes into strong being.
So thanks, Wes. And as we get back into that, how do we deliver those applications and secure those mobile devices? So when we look at the mobile front, we look at Workspace ONE, and we look at our unified endpoint management. And that's the ability to secure these mobile devices and deliver the right applications and enable, you know, your Imprivata Tap and Go solution on those Android tablets. So now the providers and the caregivers have that same thing that they're used to on the traditional PC or virtual desktop.
Right.
And that's moved over into the mobile world. When we talk about delivering these applications, you know, we look at Horizon. And now with Horizon, we can deliver apps and we can deliver virtual desktops. And this enables us, you know, to deliver into the hospital, into the home, and as you said, on the road. And we're getting the right thing to the provider at the right time with ease and simplicity of access. And what that does is give our providers more time with their patients instead of with technology. And the result is a happier provider.
And that's what we're all striving for in this partnership. You know, it's obvious to me how our partnership with VMware helps Imprivata solve for these 4 planes. And without this kind of strong partnership, we wouldn't be able to get the happy face that we get with our providers right now. So on behalf of Imprivata, thanks for the partnership, and thanks for bringing the smile to our clinicians' faces.
Yeah, thank you, Wes. And yeah, I agree. It really is a better together story.
It is.
And if you'd like to know more, please visit Imprivata at imprivata.com or visit VMware on our healthcare solutions page.
Yeah, thanks.